Fibromyalgia can be very rewarding to treat. These people did not ask to have this disease, and they're really debilitated by it.
Dr. Chad Boomershine is a fibromyalgia specialist who is trying to change the way physicians see the illness.
Fibromyalgia patients typically are not fairly well regarded, and a lot of physicians don't want to treat fibromyalgia patients, I think because they may have a poor understanding of the disease, and they think that they can't adequately treat patients in the time they have available. And so I work to try to dispel that thought in physicians.
Do the patients have widespread pain?
In a recent lecture at the Perspectives in Rheumatic Diseases meeting, he tries to dispel the myth that fibromyalgia is a time-consuming and difficult illness to treat by sharing his fibronmonic method he uses to help doctors recognize the symptoms.
So the F is for fatigue and fibrofog, which is cognitive dysfunction. The I is for insomnia, the B for blues, depression and anxiety. The R is for rigidity or stiffness in muscles and joints. And then the O is OW for pain and work disability. And so I use visual analog scale or numeric rating questions, which are very brief. So one question for each symptom. And so the physician can assess the patients, get a baseline severity score, and then put them on treatments and then evaluate them later on to see if they've improved. And it helps the patients to really decrease the amount of time they spend talking to the physician, allows them to focus on the symptoms and on the treatment, which can speed things along.
And as a result, Dr. Boomershine hopes the medical community's outlook on the illness will change too. In Santa Monica, Marquette Smith, Global Medical News Network.